it's Jessica DeMassa with WTF Health, and joining me right now I have Dr. Kyra Bobinet. She is the CEO of engagedIN, and also with us we have David Hoke. He is the Senior Director for Associate Health and Wellbeing for Walmart. So welcome you guys. Good to have you here.
Wonderful to have you.
Great. So I understand that you guys are co-launching an app that is focused on using iterative mindset on helping create behavioral change. Talk to me about iterative mindset. What does that mean, and what kind of behaviors are you trying to change?
Yeah, so we co-designed it with Walmart Associates, and what we found is that in people who succeed in changing their lives, their food habits, their any kind of habit, they all shared one thing, which was that they iterated, which means that they would tweak and kind of hack what they did until they succeeded.
Okay. And so for like that hacker mindset, you guys are talking about food and eating, right?
Yeah.
So tell me some of the things that the app helps people hack.
Well, right now we are doing food because it was the most common use case. It was the most, and we all have to eat, right?
Yeah.
So in all of healthcare, food is like the thing we all share in common. So we started there because we wanted to establish our ability to adopt, have people who don't iterate, to get them to adopt this new mindset. And we actually got really good results from the get-go. So we're launching on that, and then we'll take it from there.
Okay, and talk to me about Walmart's involvement with this. Why go with an app in the first place?
Yeah, so interestingly enough, we talk a lot in healthcare about chronic health conditions, but really no one engages in the solution. So engagement's the big issue.
Okay.
So we said if we're going to try something new, let's try something brand new. As I told Kyra, let's break it all, right? Start from scratch.
I like this.
And so we started with ethnography, talking to people, and as Kyra said, everyone likes to talk about food.
Yeah.
Yeah.
But we usually talk about in healthcare as a medicine. Like you're broken, eat this stuff and you can feel better. So if we start at the root cause, communally talking about food and influence behaviors, then we know that food foundationally can then improve your health. So that's why we get into the game this way. And it's really about applying behavior change theory to this topic versus education. Everybody knows they should eat better. Getting them to do it's a different problem.
So is Walmart a healthcare company?
Yeah, I would say we are. We're the world's largest grocer. And so we're in your medicine cabinet. We should be in your kitchen too, because food really is medicine.
Okay. And so I like that you guys are stepping in and owning that, and I like the fact that you guys are getting involved in kind of the digital transformation of healthcare. So what made you decide to go with this app, which is called Fresh Try, right? What made you decide to go this way? You wanted to break it all. What exactly were you trying to break?
Yeah, so here's a great example. Why an app? An app is democratized. Anyone can have access to it. So one of the things that we see, we have part-time employees, we have people that come and go, we have transitional associates, all of this stuff, right? So everything that we build, if we're really going to influence habits, means we have to not just work for associates on a medical plan, which is the traditional model, we have to go actually into the community. I think it's 1 in 4 people either works for or knows someone who works for Walmart, which means every community is full of current, past, or future associates or the people they love. And we know the only way to influence behavior is to include everybody. So an app, anybody can have access to. So that's why we went the app route.
Okay, I'm going to ask both of you this question because I have a lot of startups that watch, and it is like every startup's dream to land Walmart as a client, right? And I would imagine it's every Walmart's dream to land Dr. Kyra with her app as their client as well. So what did you guys learn from working together?
That we see the world the same way. We come from the same background of scalable behavior change, and we also come from the same background of, it is behavior. It's not all this like superficial stuff, that these machinations in the healthcare system. And so I think we had the same disruptive mindset. What do you think?
Yeah, I think the thing for us is that philosophical alignment. People like to come to us talk about business models.
Yeah.
That's all wonderful. I'm assuming you have a business model, but we have to be philosophically aligned. At the end of the day, aspirationally, we want to change the world, right? And we want to do that by improving health.
Yeah.
If we can align on that and what the problem is, then we can find a way to work together.
Was there one thing that you guys came this alignment in terms of mindset? Was there one thing that it was like this aha moment that you guys kind of shared? Was it around this idea of iterative behavioral change, or what was it?
Well, that was it. I mean, that to a person, every single person who was successful at changing their own behavior had that iterative mindset. To me, that was mind-blowing. As a physician, as a public health person, I think, sharing that with David, like we both were like, oh my God, holy grail. So I think that's something that I hope spreads as an inspiration for people who might be, setting goals or, doing things, having checklists, things that people really don't adopt and they don't feel good about, because what's happening is that your brain is counting that as failure, and then it stops you from trying again. So all we care about is continually trying and getting people to be in this mode in all aspects of their life of just trying things constantly, staying in effort.
Yeah, I think for me it was also the understanding that we don't have all the answers.
Yeah.
So, a lot of people come and say, a lot of smart people
Yeah.
but there's not one answer for everybody. It's really
Yeah.
acknowledging that people are the CEO of their own lives
Absolutely.
and giving them permission and power to own that by creating their own iterations. That was really powerful.
It's very exciting to me that you guys are partnered up together and that you have the ability to take something that's so simple, like an app that everybody can download, and make it available to people who are shopping in a place where there's something for everybody at a price point that everyone can afford. I mean, the potential to make some change, in the health of people is just tremendous here. What are you most hopeful for? I mean, fast forward for me and paint me a vision. 5 years down the road, what do you hope you have accomplished?
What I care about is equality of effort and resilience and empowerment. I come from Oklahoma, so I know that people who are not on the coast have just as many answers as everybody else. And so democratizing their wisdom, democratizing their own personal empowerment is really exciting to me.
Okay. What about you, David?
Two things. Number one, can Walmart become a destination for health and wellness for communities? Right? How can we do that? And then secondly, how can we turn the trend? We have a trend in America that health is declining.
Yeah.
How can we all rally together to engage each other in safe, congratulatory messaging that takes away shame and guilt, brings us more together and less divisive to turn health in the right direction?
Okay. And one last question for you. I have to ask it. So, Amazon's partnered up with Whole Foods, right? They acquired Whole Foods. How do you think that your approach, so it's like there's this scramble in this space now, right? So how do you think your approach here is different than what they're doing or what they could do with their whole Amazon, Berkshire Hathaway, JP Morgan alliance, and Whole Foods is wrapped in there? What do you think?
Here's what I think. We have 1.6 million associates today. We have more brick and mortar than anybody else, and so no one's ever going to replace that. Our associates, our humanity, is what our CEO says, will make the difference. So the more we can start with them and encourage them, they become our biggest champions, and they are in the community every day, and no one's going to be able to beat that.
Awesome. Last words, Kyra. Where can people find the app?
Both app stores, FreshTry.com, TRI.com, also as our website, and have fun with it.
It's very cool. I saw a demo of it. You guys are doing great work together. Thank you so much for joining me. It's a pleasure to talk with you both. Thank you.
Thank you.
This is Jessica DeMassa at Health 2.0 for WTF Health. Thanks so much.